Sure. Hey, everyone who is there. Good morning, good afternoon, good evening, depending on wherever you are. My name is Dethan Bionanebia. I'm an ID physician, and I'm a project principal investigator for one of the studies on the CAMO-Net Ugandan hub, and I'm one of the leads on the medicines management track of this project. I'm excited to welcome you to the medicines management module of this CAMO-Net fellowship training program. This program is very important because it addresses the most critical drivers of antimicrobial resistance. Medicine supply systems and quality assurance mechanisms are weak in most low and middle income countries. And this track is going to be taking you through 4 critical elements of what we can do to improve antimicrobial resistance. So first, we are going to look at the supply chain and distribution systems. Now, as I've already said, the supply chain systems in most countries tend to be weak. It's very hard to predict the consumption of antibiotics, and in some health facilities you have either oversupply of antibiotics or you have undersupply of antibiotics, and both of those situations can be quite problematic. If you have an oversupply of antibiotic, it could lead to overprescription of specific antibiotics. And if you have undersupply, it means that patients who would require specific antibiotics do not have access. So in this module, we're going to be looking at the supply chain systems, understanding how critical they are to controlling antimicrobial resistance. Now, secondly, we are going to look at the prescribing systems and monitoring frameworks for antimicrobials. It's again very important that all countries or most countries or health facilities have prescribing systems which are interlinked with the supply chain system, so that clinicians could know which kind of antimicrobials are in stock and therefore guide their prescriptions. And the monitoring frameworks again should be able to tell the clinician what antimicrobials are in stock, when antimicrobials are out of stock, and therefore speak to the stock status of the antimicrobials. We will be looking at the monitoring frameworks for antimicrobial prescriptions to make sure that we don't have either under-prescription or over-prescription of antimicrobials. The next thing that we are going to look at is quality assurance. Now, quality assurance is equally important in countries, in developing countries, because sometimes we have fake antibiotics or falsified antibiotics which do not meet the quality standards of medicines, and there should be mechanisms at national level to ensure quality assurance for antimicrobials, and we'll be looking at some of the quality assurance mechanisms for antimicrobials. We will look at how those quality assurance mechanisms can be implemented, and we shall look at the challenges and barriers to implementing those quality assurance mechanisms. Lastly, number 4, we are going to be looking at comorbidities, polypharmacy, and drug interactions. Again, quite a huge problem for most countries that have a high burden of infectious diseases. In some countries, for example, you'll have high rates of malarial infections, TB, HIV, and these comorbidities could actually affect antimicrobial prescriptions in several ways, including drug-to-drug interactions. And therefore, the clinicians who prescribe these antibiotics should be aware of the interactions between these antimicrobials, and they should also understand how these comorbidities affect our prescription practices. In this module, we'll also delve into the common comorbidities for which considerations have to be made for during prescription, and we will also look at approaches to tailor prescription to address the treatment needs of specific patients. Yeah, so that's it. I wish you a very nice reading as you dive into the discussion forums and the notes that are available on the web. Bye-bye.